The views and opinions expressed on this show are those of the authors. Any content provided by our bloggers or authors are of their opinion and are not intended to malign any religion, ethnic group, club, organization, company, municipality, individual, or anyone or anything.
He's a surgeon. He's a 100-ton boat captain. He's a lieutenant on Seaside Heights Beach Patrol in New Jersey. He's a member of the Coast Guard Auxiliary. He's Dr. Michael Kachmar. Need answers to your medical questions? We have them. Listen in to hear latest on medical topics related to all that and more.
Hello, everyone. This is Dr. Michael Kachmar. Welcome to Scrubbing Up with Dr. Michael Kachmar. Today's date is April the 28th, the year of our Lord, 2023 AD. And this is our medical, surgical, political show. We have Sean today. He's helping us out.
Hello.
And he's running the equipment for us.
I am.
In the background and up front. So I'm a board certified reconstructive foot and ankle surgeon. I'm on staff at many hospitals. I do surgery in the hospitals, and I've been doing this for about 30 years. If you want to get a hold of us and send us an email, it's drkachmar@icloud.com. No, .net, excuse me. iCloud. No, is it .com? Excuse me. I'm right the first time. Dr. Kachmar, iCloud.com. We'll throw it up if he could find it. There it is. So people who are on the internet and people who are on Spotify or iCloud, it's drkachmar, iCloud.com. We have a web page which is really good. It's Jersey Shore Foot and Leg Center. That's JerseyShoreFootAndLegCenter.com. And get a hold of us. So let's start the show. Today we have a really, I don't want to say controversial, but I guess it is. Hey, Sean, can you turn that camera to the whiteboard for me, please?
I will.
I forgot all about to do that. And thank you. What we're going to talk about today is about this whole thing that's going on with the gender dysphoria, and we're gonna pull the wipe here. You got to put it in a little bit more. And we have quite a bit of things to talk about here. I know it's controversial, and Sean, you can see we're zooming in perfect. That looks pretty good right there. Thank you, Sean. Thank you. So what I want to basically say, what we're going to talk about and not going to talk about. We're going to talk about gender dysphoria and what's done for it, okay? But we're not going to talk about whether or not it's, what's the causes. I'm not a psychiatrist, and I leave that up to the psychiatrist. I'm just talking about the care, the treatment that's out there from a medical standpoint. I'm not going to comment on, what's this, what's in their head, why they are gender dysphoria, and all the definitions. We'll give you the definitions of what criteria needs to be met to have surgery, and that's what we're going to focus on. So some of the things we're going to talk about today. So gender dysphoria, what is it? So what is dysphoria? We talked about that. That's a state of unease or generalized dissatisfaction with life. That's the definition, right? So that's an interesting thing.
Dissatisfaction.
Say it again.
Dissatisfaction.
Thank you. And we're going to talk about the other issues here. Who should have the surgery? What's under 18, above 18? This is where a big part of the issue is. Should these people have surgery under 18 or even puberty blockers?
So all these stars right here are when you meet the criteria that you were just showing?
Well, I'm going to go through the criteria. We talk about patients' rights. And really, I think the issue, if you really boil down to what's going on with all of these, the states banning it and people on TV and, the internet going one way or the other, it's all about, should treatment, I think some people argue whether or not treatment should be at all. We're not talking about that. Here we're talking about when should treatment start. And the treatments we're talking about are into basically, several categories. There's more than this. But you have top surgery, you have bottom surgery, you have puberty blockers. But there's also a whole set of people like they're transitioning. They're not taking anything. Then they're transitioning, but they're taking blockers. And then they're transitioning and, going into surgery. I mean, there's a whole thing. You go on the internet. I'm not going to get into that either. I'm just talking about the generalized situation here. That's what I want to talk about. Now, so we live in New Jersey. And the state of New Jersey basically has, just like every state, has Medicaid. And there's different plans. And Medicaid, I'll put my glasses on. Medicaid is basically for people who
Cash, did you sit on those? What?
yeah, I know they're all broken up. I know they're all broken. No, it's my headphones. That's the problem. It's the headphones here, but that's okay. You don't have to look at me. We're gonna look at this. So in the state of New Jersey, there's multiple companies. These are insurance companies, but this is basically Medicaid. The state pays for this, and this is United Healthcare Community Plan. So I'm going to put this up here so people could see this. Okay, you guys could go online, and you could look at what they have here, and there it is.
You want me to show
Sean,
it?
yeah, pull it up, please, Sean. That's a great thing to pull up real quick. Publish it. Did you hit publish? Yeah. Can you make it a little bit bigger for me? Yeah. So I want people to go online. This is about 8 pages. We're gonna reference this, but this is gender dysphoria treatment for New Jersey only, and so this is what you need to go to and get some research. If you want to go down a little bit, so I don't have to look at it down here. So it's right there. So here's I think it's big enough on the on
their screens. It's bigger than our view portal.
Okay, good. So here's the criteria. Let's just go now. This is the policy from state of New Jersey from an insurance company that pays for the treatment, and it pays the doctors for the treatment. And I want to make a couple things here. So now this is something here too. It says, note, this medical policy does not apply to individuals with ambiguous genital or disorder of sexual development. That's a whole different thing. Okay, but here's the so here it is. Surgical treatment for gender dysphoria may be indicated for individuals who provide the following documentation. For breast surgery, a written psychological assessment from at least one qualified behavioral health provider experienced in treating gender dysphoria is required. Assessment must be documented that the individual meets all the following criteria. Now follow this. Now let me just step back here. A qualified behavioral health provider is not necessarily a doctor.
What is that?
It could be, I went into definition, and you could, when you pull this up, you can, somebody else could do it, but they are basically, have to have a master's degree and, so I guess be like a psychologist, not even a psychiatrist. So it's not a doctor per se. It could be a doctor, but, it's a general term. It doesn't have to be a doctor.
Do you know if they could have a bachelor's degree or just?
It said master's.
Master's is the lowest?
That's what it said when I went into it. I think that's another whole argument. Should people who are not, doctors make the decision? That's something that is a little bit concerning to me. We could talk, we could have another show on that, but should a psychiatrist be the only one, making these decisions? But doesn't look like it has to be. Now, so here's the criteria. This is according to state of New Jersey. This is an insurance company that pays in New Jersey. Persistent, well-documented gender dysphoria. Okay, so whatever that is, we just discussed but that has its own definition. Capacity to make a fully informed decision and to consent for treatment. That's an important thing. You don't do any procedures in the United States and in Jersey. As a doctor, I cannot operate on you if you're under 18 without a consent. Well, some people say now 16, but there's a thing called consent. You cannot operate on somebody without them consenting to it, and it should be in writing. So in other words, if I just grab you and pull you down and operate on your arm, that's assault.
Yes.
So you have to consent to it. In New Jersey, it's been that you have to be 18 years of old to consent for surgery, but that's changed now. You could get an abortion. Abortion is surgery. It's a procedure. You could be 12, 13, 14 and consent for your own abortion without a parent. So anyway, so here you have to be able to fully informed decision and consent to the treatment. I think they're pushing in New Jersey that you can consent at 16. They want to go to 13. Okay, anyway. Right now, must be at least 18 years of age of maturity. That's in state New Jersey. So everybody's on the internet, they're going to operate on young kids. According to this is the criteria, 18. So that, they're not going to approve anybody under 18. But it's a little bit, there's a little bit different here with breast surgery. But let me just, favorable psycho-behavioral evaluation to provide screening and identification of risk factors for potential post-operative challenges. Now, that's for breast surgery. Some places now are allowing breast surgery at 15 with parents' consent. I believe in Boston they're allowing that. I guess here they don't. Can you just go pull up a little bit so I can see? Now, this is for genital. So now, breast surgery, just so people understand, breast surgery is not genital surgery. Breasts are not considered genitals. I don't know if you know that or not.
I know.
Okay. A lot of people don't. But, so for genital surgery, a written psychological assessment from at least 2 qualified behavioral health providers. Again, not necessarily doctors, but they usually have to have a master's. Experience in treating gender dysphoria. And so they must document here persistent, well-documented gender dysphoria, capacity to fully informed consent, same thing, must be 18 years of age, age of maturity. I don't know why they say, I guess if you could change the age of maturity.
But they're not even saying maturity, they're saying majority.
Excuse me, majority.
But what do you think that means?
That's a good question. I don't.
Right? Is that just the most
I
people
thought, I don't have my glasses on. I thought it said
so
majority.
like the most people around 18, or they're going to go less? Age of majority.
Why don't you look it up while we're doing, I'll look at it. Hang on a second. Just keep this here. So favorable behavioral evaluation provides screening and identification of risk factors for potential post-operative challenges. So that's an interesting thing. These do have complications. Now, a couple things here. What does it say about?
It's just a sign that you're an adult. So yeah, it is maturity, I guess.
Yeah, but it's another way to majority. Yeah. And here's the thing: state of New Jersey now. I can't. It's hard for me to find out, but the age of consent for sex is 16.
Yeah, I think that's why they're writing that byline there.
So now, 16. Change. So this says 18, but can they do it under 18? And as articles that have been published, people want to do this earlier. Go down. There's still some more stuff here. Okay. So this is still going with the criteria. Complete at least 12 months of successful, continuous, full-time, real-life involvement in the experienced gender. So that's when you that's when you start, starting. You may not even be taking medications. You're doing that stuff. I need to look down here.
I'm just looking at everything.
All right. Complete 12 months. Here's the interesting thing. Complete 12 months of continuous hormone therapy. That's a year now. Appropriate for the experienced gender, unless medically counterindicated. And then the last one is here, treatment plan that includes ongoing follow-up and care by a qualified behavioral health provider experienced in treating gender dysphoria. Now, so what we're talking about is a couple things here. You need to be on, for the surgery, you need to be on medication, I guess, for 12, continuous hormone therapy, which is puberty blockers for a year. Well, how are you going to, if you're 18, and that's where they allow the surgery, that means you got to start the puberty blockers at 17. There's people who want to start it at puberty, which could be 13, 14. So there's arguments about that. And I think that's where a lot of this is coming to an argument, when and where. Okay, so what are we talking about now when we talk about surgery? So the above criteria, when the above are criteria met, the following surgical procedures to treat gender dysphoria are medically necessary and covered as a proven benefit. Again, I want to make you understand, this is surgery that will be covered by the state of New Jersey, insurance plan that's paid by the state. This is a state welfare. It's funded by the state of New Jersey. So your taxpayer money is going to pay for this, just so the people. And if the child, if they don't need the parent to be involved, the child, I guess, could then consent to it. I mean, a child could get an abortion in New Jersey at 12, 13, 14, 15. So I would imagine here there's people that are pushing for, or not that it's law right now, okay? I don't know what it is, but this is where the argument is, when does it start? Right now, according to this insurance company, it has to be 18. And they have to have a year.
Yeah, I think this is the Medicaid policy
guidelines
for all this. Yeah,
right.
This is when they'll do it.
Right. So, that's now here. So, what is an approved procedures? Okay, one is bilateral mastectomies or breast reduction, basically removing your breasts. Now, I know places will do that. I don't know about in New Jersey, but I think in Massachusetts, with the parents' consent and all this other criteria at 15. All right. Creation of a clitoris, removal of a uterus, hysterectomy. You could go on and on here. Removal of penis, prosthesis of a penis, just basically removing your genitals and making new ones. What gets me here is a hysterectomy. And a hysterectomy is taking your uterus out and maybe your fallopian tubes, which means you can probably never have a baby. Now, there is interesting, we talked about this. There are people now doing uterus transplants. We have an article about that. So I guess if they take it out, maybe down the road they could put it back in. I mean, this is just crazy. It boggles the mind where we're going with this as far as from a surgical standpoint. As a doctor, it's just an amazing thing to me. So just go down a little bit more. So, oh, wait, went too far. Where does it say? Yeah. When a bilateral mastectomy or breast reduction is performed as a standalone procedure without genital reconstruction procedures, completion of hormone therapy prior to the breast procedure is not required. Interesting. So that's interesting. So if you have your breasts, you don't need to have the puberty blockers. See, this is to get down to the weeds. This is where the doctors, we look at it and you start saying, well, and this is this is interesting. Now, there's a whole bunch of stuff that's not covered, like a nose job, liposuction, all of that. So we don't need to get into that. But this is, just go to the top again so people could look at this. So I want people to go, who are on the podcast, you go to United Healthcare, which is a community plan. It's in New Jersey, United Healthcare Community Plan. And this is a insurance company, state of New Jersey, and they have it. It's on the internet. You could just Google it like you did. It's gender dysphoria treatment of New Jersey only. And we just cited what they're putting here. Okay, and so that's that. That's what's available. How many are being done in New Jersey? I don't know. And is the criteria going to change? I know there's bills out there who want to change the area of the consent, whether or not parents should be involved, and those are the little things we're going to talk about right now. So that's, you could let me go back here. So let's go right here. So here's the deal. Should these kids be having surgery under 18? Now, there's, and if they are, there's a lot of studies on that paper we just looked at, the United Healthcare. In the back, they have multiple papers that they cite that I recommend you guys go to. And you could go look at them and read them. And there's a whole bunch. And there's different papers that are written out there whether or not children should have the surgery. There are a group of people and researchers that say that the earlier you start this, the better off you are. Now, what do you mean by better off? Better outcomes. What's the outcome that we're looking for? To be happy, I guess, right? To be happy.
And yeah, life, liberty, pursuit of happiness.
Because basically, gender dysphoria means you're not happy. You're not happy with your life.
With your gender.
Well, your gender, yeah. But that's the gender, and then because of that, you're not happy with life. So the outcome, in my opinion, would be then to be happy. So the real question is, and I'm not having an answer to this, should the kids have surgery under 18? There are people pushing for that. Then the next question is, let's just say that you look at them, and I don't think the papers are that clear, in my opinion. But let's just say that we say that's the case. Then who makes the decision? The child or the parents?
Cash, I'm just gonna let you know this because it's gonna drive you crazy. But the camera's autofocus has not been on this whole time. So every time you put your hand in front of the screen,
okay, I won't. Okay, yeah. I won't do that. So yeah. So what do you? So should the parents, if the kids, if it's deemed that we need to have this done on children very, very young for the best outcome, and I'm not saying that's the case yet. I think it's not. It's an open question. Should the parents be able to say yes or no? And should a child be able to consent? Now, there was a paper by the military. I think we had it on our last show, and they're saying that children 7 or 8 years old could consent. So that's a big issue. So that's one issue. What do you think? Let me just ask you. So let's on that one topic. On that one topic right now. What do you think about
what topic?
People under 18, should they have surgery done if they had gender dysphoria? Which I just gave you some feeling. What kind of it is? It's pretty heavy duty surgery.
Cash, I'm gonna
defer.
Flip the mirror on you and just say I believe in sovereignty.
Yeah, go ahead.
They can do whatever they want.
But can they decide? Are they young enough? Can they drive a car? Can they fly a plane? No, I'm asking you a question.
Like 30 years ago, you could drink and drive, or 50 years ago, you could drink and drive.
No, but there's age limits. Do you think Do you think a child under 18 or somebody who's young has the ability to make decisions of that magnitude?
I don't know.
Okay, that's a good. That's why I'm asking. That's all. Now, should the next question? There's no answers to. I mean, the next question is: should the parents have the right to decide on somebody who's under 18, whether or not they should have any procedure done to their body?
Yeah, I mean, they should. I don't know. They should.
Okay.
They're there in the room. They're there in the house. I don't know.
You don't know. So that's another one. Well, this is it. You're being honest, okay? You know, because it's scary. And there's where the battle arises. My opinion, I've been on this earth for a long time. I don't think children can make the decision. The one thing is, abortion is bad enough, but abortion is not going to. I mean, you're going to get rid of a fetus. You're going to kill, in my opinion, an unborn person. Okay, I think abortion is maybe 15 weeks is reasonable. I'm not totally against abortion, but I'd like to have it, done as least as amount as possible. But abortion's a pretty safe procedure. It's probably not going to kill or maim, that child who has the abortion. Maybe it's going to give them some psychological issues down the road. All right, but I think the danger more with an abortion is what are you doing to that fetus, which is another argument, another show. But when you talk about doing a hysterectomy, removing their breast, removing their penis, removing their testicles, that's it, man. You're gone. And if and it's not like the surgery down the road, you have no issues, no problems. You need to be on medication the rest of your life. You're going to have problems. If you are a woman and you trans to a man, you're not going to be able to have a baby unless maybe we could perfect putting the uterus back, in a man, which is kind of crazy stuff. They're trying to do it. My point is that I don't think a child should make the decision. This is where a lot of the stuff's coming. I think the parents should be involved.
A crazier thing with that is just like men's hips are not designed for that.
Yeah, they'll have to do
at the end of it. Like,
yes,
if it ever even is possible.
Yes,
like it's going to have to be C-sections every time.
Yes. Well, that's a good point, and they talk about it in this article. The other thing, so really when we're talking about it is, I think the big argument in this country, if you really get down to it, I mean, there's people arguing whether or not it's real, whether or not they should be treated at all. We're not getting into that. I'm not an expert in that. I don't have the training. But what I think though is when to start treatment. And that's where I think a lot of reasonable people are. Even if these people have issues, whatever this issue is, when you start treatment. And I want to make a point about why I have that position. People have been having, sex changes for years. It's nothing new. It seems like it's a lot now, and a lot more kids are doing it. But there was a guy in Colorado back in the 70s that I did 60 Minutes did a show on. And he was doing like 100 a year of, sex changes. I don't know what if it was mostly men into women, women into men, but he was doing it. They've been doing it in other countries. I remember reading an article maybe 10 years ago in Iran, which is a Muslim country, and the government was paying for the surgery. Because the reason why I read it, there was a lot of complications. They were having a lot of problems with it, but they were doing it. And I don't know if they did it because, they're Muslim, and if you're considered gay, they don't allow that.
I think it was some loophole, like how.
Right. So my point is that they've been doing this surgery for a long, long time. It's been around. I think we're having an issue here. The big issue, if I try to, go down the middle of the road, is when do you do this surgery?
Just watch the camera when you're moving your hands.
Okay, I'm sorry. So let's go. Now. Let's go to this next thing here. So this is a Justice Department challenges Tennessee's ban on gender affirming care for minors. Remember we talked about. So go to my thing here.
Want me to pull it up?
No, go to my iPad. Let's go to my iPad, and let's go here. So I have it here. So this is an article, CNN Politics, and I just want to talk about this a little bit here because this is an interesting concept here. So the Justice Department on Wednesday filed a complaint challenging a recently enacted Tennessee bill that prohibits gender-affirming care for minors, saying it denies necessary medical care to youth based solely on who they are. Okay, and it says the DOJ argues in its complaint that the legislation violates the 14th Amendment, which equal protection clause now in the 14th Amendment, that's states cannot inhibit anybody's rights, life, liberty, and pursuit of property. Okay, that's the 14th Amendment. That was a Civil War amendment, by the way. But there's sections of it, and this is under the Equal Protection Clause. By discriminating you cannot. They're claiming that they're being discriminated on the basis of both sex and transgender status, and he asked the court to issue an immediate order to block the law from taking effect. Okay, So this is interesting because now we're talking about the law now. So what does the law really do? SB 1 makes it unlawful to provide or offer to provide certain types of medical care for transgender minors with diagnosis of gender dysphoria. And I'm just trying to look here what age, and this is the thing. It's all about the age. And sometimes, these bills on both sides, everybody's going crazy. They're banning all of it or they're banning it at certain ages. And I'm trying to look here, when they say minors. I guess they're talking about people, this bill was put out there to limit surgery or any procedure on a minor, okay? Now, again, what you're doing here is, this is where the argument is. So this bill, nobody's saying that the surgery is not necessary or not adequate. It's at the age. So, and is it discrimination? And I'm going back to the same old thing with regard to this battle. I have no problems if you're an adult doing whatever you want to do. You want to have plastic surgery, you want to have your boobs removed, your nose checked, done. I kind of wonder though if somebody who's psychologically ill, I'm not talking about transgender, somebody else, say I want to have my arms removed for whatever reason. There's doctors who have to perform it. I wonder about these doctors, what their ethical position is, but this is about limiting children because they can't make their consent, and then you'd have to have the parents. So again, Sean, let's just say we allow this. Say it is against the 14th Amendment. Children have to be able to consent or have the surgery done. Should the parents still be involved? And if the kids could consent, right? There's this thing in our world right now where we say that people are incompetent. That's why I'm saying this is a unique thing.
Who's saying that?
It's always been where we didn't let children. We don't let a child sign a contract. We don't let somebody get married. We don't let them fly a plane, drive a car. These kids who are 12, 13, 14 years old can drive a plane, fly a car. Mm-hmm. I mean, we say that they're not mentally capable, and this is heavy duty surgery. So you got the law coming in, and you have common sense, and you also have parents' rights. I would say this, that this law here is, we have to make sure that the science, the medical science, is really adequate, and that if we operate or don't operate. So here's the real question again I'm talking about. If we operate on these children or give them blockers before 18, are they any better if we wait until after 18? Remember we talked about this?
Yeah, we have to find out.
That's the $50 million question. I think that's a big question. I don't think anybody, if you're telling me, if a kid's got cancer at 10 years old, okay, let's change the thing. They got a bone cancer at 10 years old, and that bone cancer is going to kill him. And I say to you as the parent, listen, we got to remove his leg, inside, put new bones, take that cancer out, chemotherapy, and you say no. Because people used to do that, like Jehovah's Witness, stuff like that. Well, I would then get it. I was the doctor or the family, or I would get a court order. I'd get a judge and say you're crazy, and we would probably have the child have the surgery. Okay. Now, could the child consent to that, and should the child consent? If it's his life. So so I understand that where they're coming from. They should, but that's a pretty obvious medical decision. This stuff here is a little bit, I think.
Gosh, what if this
nuanced.
is just a deep-seated war from AI? Just that's stopping us from reproducing in the future. This is a long-term, like a psychosocial war.
I don't know. I don't know about that.
Why not?
I don't know about that. But my whole thing is
everywhere.
I understand, but my whole thing here, Sean, is that with these kids, so that there's states that want to ban it underage, period, which means then there's doctors and societies are fighting against that, saying, well, they should have the treatment. That's medical. But then you're saying the government's saying it's unconstitutional. Two different things. Whether or not it offends or goes against the 14th Amendment, I don't know. I'm not a lawyer. I'm not a and again, I just don't think that a child personally believe, in my experience, that a child should not be consenting to surgery like that. But if it's something that's so obvious that needs to be done, if the literature is so bulletproof, which I don't think it is yet, then you could get a court to say child has to have surgery, or has to have this affirmative action or affirmative treatment. But to let a child do it right now and consent, I think is very dangerous.
Well, the child can't necessarily consent right now because they need two healthcare providers to help them go through that process.
That's a good point, but that's always questionable too. I mean, you got to trust them, or they know what they're doing. People make mistakes, and ultimately, there's other forces that could be involved in whether or not the surgery should be done. Listen, all these things I showed you here, they're billable, payable procedures. Mm-hmm. This is big money.
Oh yeah.
Puberty blockers is big. There's a pediatrician could open up a 3-story building in Toms River.
Yeah, someone's making money off of this for sure.
I mean, for breast surgery, I mean, they're getting $6,000-7,000.
Yeah, you can't deny that someone's making money off of this, whether it's good or bad.
And I always wonder if that's part of the problem here. And also, what I'm saying is, go look at this paper. Look at the papers that they cite in here for their science. And I don't think it's that bulletproof. And I know the AMA. I know there's a lot of entities that go for it. So let me just go here. So let me go here. Let me just, before you do, so this is, you could go back to my thing here. I want to show you. This is another one here. So this one here, it says trans kids treatment can start younger. New guidelines say. This was June 15, 2022. And this was an article here. And so this is, say, a leading transgender health association has lowered its recommended minimum age for starting gender transition treatment, including sex hormone and surgery. So this is the World Professional Association for Transgender Health said hormones could start at age 14, 2 years earlier than the group's previous advice, and some surgeries done at 15 or 17, a year or so earlier than previous guidelines. The group acknowledged potential risks, but said it is unethical and harmful to withhold treatment. Okay, you follow me? So that's interesting with that. Mm-hmm. The association provided the Associated Press with an advance copy of its update ahead of publication in a medical journal expected this year or next year. The internal group promotes evidence-based standards of care, including more than 3,000 doctors, social scientists, and others involved in transgender health issues. There's a lot of people who, so I don't, everybody's like getting all crazy. I'm not so sure. I mean, should we? I think that there's a lot of people saying that this evidence is really there, and they should have surgery done. They should have stuff. But remember, back in the days, we had a lot of things we thought, lobotomies, bleeding. I'm not saying this is in the same league, but I'm always dubious about when the medical profession says, oh, this is definite. I've been a doctor for 30 years. We've changed our, you put 30 doctors in a room, you're going to get 30 different opinions. So I'm a little bit skeptical about that. I'm reading the articles, but it's not my specialty, because it's this, I don't understand, and I don't know if anybody, it really just gender dysphoria, what it really is, and where does it, come from? Can you cure it? Is there a pill? How about, no surgery? I mean, can somebody invent, I'm just saying, I don't know. But you have a lot of people saying that these kids should have the surgery earlier than later, which is that's a big argument right now. And then if that's the case, who could consent to it? And you got medicine coming involved here, Sean. I'm trying to give you an idea, and law, which is you got two things coming together. It's not that easy. 14th Amendment, what your right has. Also, like you said, life, liberty, and the pursuit of you always say happiness, but I say property. But so there. What happened here? Oh boy, decline. So they're talking right here.
Ads every time.
I know it's hard. This is what it is.
This is the world.
Well, that's okay. We all, So it goes here a little bit. Most experts say more kids are seeking such treatment because gender questioning children are more aware of their medical options and facing less stigma. Critics, including some from within the transgender treatment community, say some clinics are too quick to offer irreversible treatment to kids who would otherwise outgrow their gender questioning. Psychiatrist Eric Anderson resigned her. Is that Eric? Is that her name? No. Yeah.
Erica.
Erica. Excuse me. Her post as a board member of the World Professional Association for Transgender Health last year, after voicing concerns about sloppy treatment given to kids without adequate counseling. And she is still a group member and supports the update guidelines, with emphasize comprehensive assessment for treatment. But she says dozens of families have told her it doesn't always happen. They tell me horror stories. They tell me our child had 20 minutes with a doctor before being offered hormones, she said. Parents leave with their hair on fire. So here I'm just keep going. Recent study just suggests that rate in kids is as high as 1 in 5. This is estimated number of transgender youths and adults worldwide, partly because of different definitions.
That's more than COVID.
And suggesting a range of between a fraction of a percent to adults up to 8% of kids. 8%. So here's what it says. Still, Anderson says she condemns politicians who want to punish parents for allowing their kids to receive gender treatment, and those who say treatment should be banned for those under 18. And this is what she's saying. That's just absolutely cruel, she said. So the battle lines are being formed. Not only your battle lines are being formed in medicine. You have a group of people in medicine.
Yeah, this lady's on the trans community council.
Right. Well, she's biased in that way, but I got people I could pull up.
She's against. She's saying that 1 in 5 is ludicrous.
Oh, I see what you're saying. Yeah. But she's also saying here that she says she condemns politicians who want to punish parents for allowing their kids to receive gender and those who say
she seems pretty centrist about the whole thing.
Receive gender treatment, and those who say treatment should be banned. So she's back and forth. Mm-hmm. I mean, punishing parents for one way or the other. But let me see. What does she say here again?
Anderson said she's heard recent estimates suggesting the rate in kids is as high as 1 in 5, which she strongly disputes. So she's being a centrist about this.
No, but she wants to ban people who say treatment should be banned under the age of 18. So she wants this done. She's saying that she wants it done under 18.
That's a centrist opinion, though. She's not saying but like at 1 in 5 is too high. Like she's not.
Oh, I understand what she's saying. She says the ones who need it. The ones who need it.
She's not pushing it on everybody, but she's saying that happens.
That's a good point, because I watched the Jordan Peterson show. I just finished the camera with when he it was Joe Rogan, and he had Jordan Peterson, and what Jordan Peterson said on that show, which really was interesting.
I think you've said it on the last 3 of these.
Yeah,
80%, 20 of them end up being gay, but 20 of them are.
No.
I don't know.
No. What it was he said about 90% of the children who classify with gender dysphoria.
I think it's 80, but
no. He said 90. I'll tell you what he did. He said 90 that by 18.
Dysphoria.
But you take 100. Out of that 100, by 18, 90 of them decide that they're okay with their body. This is what he says, not what I'm saying. And he says out of that 90, about 80% of those wind up being gay.
Out of the 90%, out of the 100, 90 are fine. Out of the 10%, 80% of those end up being gays.
No, the 10% go, no. Out of the 100, 90 are fine with their bodies, 10% continues to be gender dysphoria. Okay. And then out of that, I
think it's out of that 10%.
No. 80% of those are gay.
Out of the 10%.
No.
8 out of 10.
No.
So then that leaves 2% that becomes transgender. That's his argument.
No, 10%. Listen to me. You take 100 people, right? Yeah. He said 90% of those people. 90. That means 90. So by 18, they don't have gender dysphoria anymore.
Yes. So then 8 out of the 10%.
No. The 10% that is left, they are still have gender dysphoria, and they won't wind up needing surgery or whatever. So now you still have that 90. Out of that 90% that's left, 90 people, 80% of them wind up being gay.
Okay, so 80% of 90%.
The 10% that's not gay, I guess they just go normal. Not normal, but not gay. So straight.
But those numbers, but so it's 80% of the 90% that's already been broken down. Like it's keeps breaking down.
Right. But basically, what he's saying is about 10. To take home away from what he's saying is 10% of people who have gender dysphoria when they're young outgrow it. Now, I don't know if that's true or not.
I actually heard that it's false. That he was misquoting it.
It might be, and that's what we don't want to. It's not my. It's not. I'm just saying is that where the argument is that we have to get to the real science here, and I'm not trying to put out anything that's false. I don't know. I have no idea. I just tell you that there's a lot of reasonable people who are saying surgery should be done at a younger age, and we don't know. I just don't know if that's the case or not. I'm just throwing it out.
I'm gonna try and find it, but keep.
Yeah. So I'll go back here. So if you look here, transitioning under the roof with your parents so they could go through with you, that's really beneficial. He said, I'm so much happy for that. I think the parents need to be involved. I really do. I think that's the most important thing. And I was. What? I'll tell you another thing. I went on the internet and looked at YouTube videos of people who transitioned, and they seemed really happy. They were talking about it. They did really, good. What I feel bad is that a lot of the trans people who are trans don't think that the Christian church will accept them. I mean, trans come to our place. I mean, to me, I don't care if you're trans, you're gay, whatever you are. You're welcome. I don't. But my point here is so this article here is they're saying that you should be starting this younger. That's my point. And this seems, like you said, she seems like a very reasonable, this doctor. And, she wants the parents to be involved. It should start younger. But she's saying that maybe some of these kids shouldn't get it at all. It's sloppy treatment, sloppy diagnosis, right?
Yes.
And I think that's a good place to look. Let's try to minimize, if this is a real thing, can we minimize, let's make sure that we're getting the best ones. And I don't know about whether or not you should wait. That's a long thing. That's a big controversy. The other thing too is the law. Do you have the right to have this surgery? If you're under 18, if your parents don't want it. I mean, how does the 14th Amendment fit? That's not for me to discuss. I have no idea. You need a constitutional lawyer. So let me see. Blockers can weaken. So let's just talk about a little thing. So this is the article. I think it's really a very great article here.
I know you didn't pick up on the person it was written on had a very is about trying to be more down the road than just pushing it on everybody.
Yes, I agree with that. No, that's why I pulled this article up. I didn't remember. So this one here, what is this? Bundy, who identifies as a non-binary, supports easing limits on transgender medical care for kids. Those decisions are best made by parents and parents' families and medical professionals, they say. It definitely makes sense for there to be fewer restrictions because then kids and physicians can figure it out together. So this is Dr. Julia Manson, an Oregon pediatrician who has raised concerns about the increasing number of youngsters who are getting transgender treatment. Said too many in the field are jumping the gun. She urges that there isn't strong evidence in favor of transgender medical treatment in kids. Now, this is somebody else now. This is an Oregon pediatrician, okay? So you go back and forth. And this is what we need. We need to have calm, not emotional discussions. Again, I'm not getting into the 14th Amendment issue, and the bans and all of that. I'm not so sure that's where it should be. This should be what this woman's saying about. It should be about the medical community. That's why I'm jumping in. In medicine, the treatment has to be proven safe and effective before we can start recommending it, she said. Experts say that most rigorous research studies comparing treated children with outcomes in untreated children would be unethical and physiologically harmful to the untreated group. So I guess they haven't done the studies. It's kind of hard. How can you test a parachute? You take 1,000 people, give half of them parachutes, the other half, a bag filled with newspaper and throw them out the plane.
Hope it works.
Hope it works. But then again, the new guidelines include starting medication called puberty blockers in the early stage of puberty, which for girls is around 8 to 13, and typically 2 years later for boys. There's no change from the group's previous guidance, blah, 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 blah. And so breast removal for trans boys at 15. And what else here? I'm just going down here. And it goes on and on. You have different people here. So this is Dr. Joel Frater. How do you pronounce that, Sean? Can you read that? Frater. You want to read that? Read that.
Dr. Joel Frater, a Northwestern University, a pediatrician, that's just a misprint.
Right.
A pediatrician and medical ethicist who advises a gender treatment program at Chicago's Lurie Children's Hospital, said guidelines should rely on psychological readiness, not age.
Keep going. Keep reading what he said.
Frater said brain science shows that kids are able to make logical decisions by around age 14, but they're prone to risk taking, and they take into account long-term consequences of their actions only when they're much older. Colleen Williams, a psychologist at Boston Children's Hospital Gender Multi-Specialty Service, said treatment decisions there are collaborative and individualized. Medical intervention in any realm is not a one-size-fits-all option, Williams said.
Okay. All right. You can go back to me. You get at it. That's a good point. So there you have another perspective, right? Where, you got different doctors arguing one way or the other. And you, like you said, the middle of the road. So we're talking about treatment. And again, when it should be. Now, they're saying that the children at 14 can make a decision. But the parents are still there. So maybe the children can, but I think it should be a collaboration. I think it needs to be the parents need to be on. If the parents are not on board, then we have a problem. And so what do you do there, And this is where I'm trying to discuss this. Somebody's going to have to make these decisions. So let me just go here. So let me see. What age? I want to go here. I didn't want to hit this one. Hang on. So I'm going to give you another one here.
We're only showing you right now. You're good.
Yeah. So we're going to go here. So this is So this is our New Jersey. Interesting. So you could go to the
ad pop up.
Yeah, I know these ad pops up. So this is interesting here, just in New Jersey. So this was an article published in April 4th, 2023, just recently, right? So right, this was just a couple weeks ago.
Yeah.
So Murphy, which is our governor, people who don't know, makes New Jersey safe haven for providers / patients seeking gender affirmative health care. New Jersey became a safe haven on Tuesday for transgender, non-binary, and other gender diverse people seeking gender affirmative health care. Governor Phil Murphy signed an executive order to protect healthcare professionals and patients from facing repercussions when they seek, receive, provide, or travel to New Jersey for gender-affirming healthcare services. It orders state agencies not to discriminate against people based on their gender or gender expression and sexual orientation. Gender-affirming care includes medical processes such as surgeries or hormone replacement, along with mental health services and non-medical support. Not all transgender or non-binary people undergo medical procedures to affirm their identity. It's just an interesting thing, too. They don't do that. Now, they are trying to ban, it says right here, gender-affirming care banned in 9 states. So we're just going here, can't cooperate with other states' investigation. Under Murphy's order, state agencies cannot cooperate with other state investigations of someone traveling to New Jersey to receive gender-affirming care or someone facilitating such a visit, which is pretty interesting. So if you have a state that bans it under kids under 18, well, first of all, we're not doing under 18 here yet. I don't know if we are. This is where the argument is. So, but let's just say that New Jersey starts operating on kids 15 or and Alabama doesn't have it, and so they come to the state. What's going to happen? That's going to be a battle between the states, right? Yeah. See where this is shaping up to? I mean, this is I can see this being a crazy thing. Now let's just look here. New Jersey Transgender Equality Task Force, which Murphy formed in 2018, flagged gaps and disparities in protection apparent for the LGBTQ plus people, particularly those seeking gender affirming care in a 2019 project. Anyway, so that's just recent. This is recent news we're talking about. And, there's bills all over the place. Everybody's trying to grapple with this. You could get rid of this, Sean, for me. Just go back to me. And what do you think about people coming to another state? That's another whole argument, right?
From like Alabama to here?
Yeah.
Do they need residence?
I don't. That's a good question. I don't think so.
I think they would.
No, you could go. No, you could go. I could go to Florida and have surgery done.
But you don't pay for Medicaid.
Well, that's a good question. But you might be able to. That's a good question. I don't know that.
I'm sure people can find the loophole, but I don't think it's that easy.
That's a good one, and I don't know. That I really don't know. I really don't know. That's a good question. But if they can make it easier, I think they would. Let's see, I think we talked about it. So this is the last one. Don't put me up yet, but you can see where it's boiling. It's going. So this governor here and this state here believes that they should be treated, and maybe treated at any age. I think there's some bills in New Jersey that want to push the age of consent to maybe 13. So you see what's happening. The medical profession is pushing for a younger age treatment. And then there are doctors and other people pushing back, but then you have the state and the federal government pushing back. And they're citing rights, people's rights, and whether or not they should have it. So again, think about what we talked about. Is it the same as having cancer in your leg and you're denying treatment? If you have enough evidence, and how much evidence do you need, that these kids do better with the surgery younger than older? I just have a hard time taking a person and removing their genitals and doing a hysterectomy. I mean, you're changing. I mean, they could have a lot of complications going forward. I mean,
we don't even know what the appendix does.
No, but I could tell you what, I've taken out tons of appendix. I've had people.
No, I know, but we don't even know what it does.
It doesn't matter though. But we don't see any
problems.
problems.
Making an analogy.
No,
we don't know what one part of our body does, let alone knowing what all parts of our body does. We're not experts on anatomy.
No, I am.
No, Cash.
Tell me.
You're an expert. We don't know everything. So removing it, we don't really know what the appendix does. It
doesn't matter though. But nobody.
You're not hearing the analogy. We don't.
It's not different. It's different though. Why?
I'm saying it's not different.
Why? How is it not different?
Because we don't know what we do when we mess around with it now, let alone.
No, we do know.
We've
been taking appendixes out for 100 years.
I'm making an analogy.
But you're saying, but your analogy's not.
It's not clicking for you.
Go ahead.
There's organs in our body that we don't know the full spectrum of what they do.
We don't know how they work completely, but we do.
We admit that with the appendix. We don't know the full spectrum of what a uterus does for the body.
But we know if you remove a uterus, what it does to you. We know if you remove an appendix, what your life expectancy is and what complications you could have. That's definite. I can tell you right now.
Does your life expectancy go down if you remove an appendix?
No.
Okay.
But if you take your ovaries.
But we don't know. But what if removing the appendix has further complications that we just haven't lined up yet?
It's been a long time. We haven't been giving children puberty blockers for that long, and we haven't been doing these sex changes on young kids.
That's the analogy I'm making. That's not clicking on
but
you.
No, but there are surgeries that are pretty straightforward that we know. I mean, heart transplants, kidney transplants.
There's things that we know, but I'm saying there's also things that we don't know.
You'll never know everything.
Yes, that's what I'm saying.
But
that's
here's
literally what I'm saying.
But then you could say then never do the surgery. We'll never know, so don't take a gallbladder out.
I'm not saying that.
Well, what I'm telling you is, let me finish my thought now. If there's enough preponderance,
we're agreeing right now.
Yeah, we are. If there's a preponderance of evidence with regard to transgender surgery, okay, then fine. But my thing is right now is that what literature I see, it's not 100%. But there's a lot of doctors who know more than me that are pediatricians and psychiatrists are seeing it. But there are other people who are pushing back. What I'm saying is that if there could be two competing studies, let's just say that people who have the surgery are happy down the road. Okay, we need and we need to see that. That's long-term studies, and then you got to see the people who didn't have the surgery, how they fare. Now, I just was watching on the internet. There was a woman who she was a man. She transgendered to a female. She was an airline stewardess at United Airlines, and she passed away. I think she committed suicide, So, I mean, and she seemed to be very happy. I don't know if you have complications from the surgery, scars, urinary issues, stuff like that, will you be happy? Now, is that just normal complications of surgery? You could say, well, you could have that with anything, having knee surgery, hip surgery, stuff like that. I think here, though, is what's the diagnosis, and that's for the psychiatrist. Is this, what is this? Is it real? It's been around for years. People have gotten the surgeries. So I guess you could say there's a lot of, should be able to get evidence if these people feel better and do better. But getting back to the children, this is where the big issue is. Should the children have surgery? And like when I went back to the board, you can't answer, under 18, this is where the battle is. I don't know the answer, just like you don't know the answer. I mean, does a child at 14 years old have civil rights. Yes, they can't be murdered. If you murder them, I mean, they can't be abused. I mean, so every human being has civil rights. In fact, I would argue that even in the womb they have rights. Okay, but they have civil rights. Now, if the surgery could really help them and makes a big difference, then should a state government cannot stop it. That's the 14th Amendment. So there's the argument. No state should. If you look at the 14th Amendment, it says states should not infringe on your life, liberty, and the pursuit of happiness or of property. Yeah? So there you are. Again, getting back to this whole thing, can children consent? Can they consent to anything? Should they consent to anything? And if you talk about, forget about having surgery, can a 14-year-old consent to a contract to buy a house? Or, so we get into this kind of thing. It's a mental issue.
Yeah, no, but also just like the timing, the puberty thing is the part of this issue.
Right,
like
because you can't wait.
Further complex, makes it complex.
Right, because
complicates.
Yeah, because you could wait. You could say to a kid, "Listen, you can't fly a plane now, but when you turn 18, you fly, and it's not going to hurt them. If anything, it could save them." And same thing, right in the contract. Here, the argument is if you delay the surgery or the puberty blocker, you're hurting the child. That's where the argument is, and I don't know the answer. And
time will tell.
And I think that the parents, though, it's not good to take the parents out of this, though. I think parents' rights should be there. And if the parents don't want the surgery done and the child wants the surgery, then go in front of a judge.
Yeah, I mean, the family nucleus has been bastardized for decades at this point.
Right. What's wrong with that? What's wrong with having if the child is declaring themselves, having gender dysphoria, and they go and you have them see the psychiatrist, psychologist, whatever, and they're recommending some kind of procedure. And let's just say you don't feel that it's the right thing to do as a parent. You think your child is maybe, you want to give it time. And the child's absolutely, I want to have this done, and it's a big battle. Well, then I think in that case, maybe you should go to a court, let a judge. I mean, I've seen this when I was doing my training. I'm pretty sure it was Jehovah's Witness, and we bring people in, they need to be transfused with blood, and they didn't want it. They didn't want any blood. I mean, we had a kid, would die, and you get a court order, and you give the blood. They held treatment. I don't know if that's still, real popular anymore, but so you wouldn't hold treatment. You would say, if there's this kid who needed cancer treatment, and the parents didn't want it, you'd be like, get the hell out of here. Mm-hmm. So it's a crazy one. All right, so the last one I want to pull up here. This is great. So now all of this. So where are we at this? Tell me what our position is now. What's our position?
We don't know.
We don't know. We don't know anything. I would say this just to finish up with this, and I'll go to the whiteboard. It's a controversy right now. The states are going to battle over it. It's going to be a big part of the, a question during the election, presidential election. And I think it's more about, it's two things that I see people talking about: parents' rights and also, my opinion, surgery after 18, I have no problems with. I wouldn't even discuss it or argue. I mean, if you want to have it done, fine. I think there's,
who are we to say?
Who are we to say? Right. The real argument here is whether or not children should be having it and what level. And I like those doctors saying it should be a family thing. It should be the doctor. Maybe that's where it really should be, between the doctor, family, and the parents, and the government stay out of it. Maybe that's the best place. But again, as a society, we do have to get involved. We talk about abortion. We talk about all kinds of things that are recommended. This is This is a hot topic. It's a tough one. I wanted to tackle it today because I just wanted to show you where, like the state of New Jersey, you could get it done. The state pays for it. They're accommodating it, and it might go younger. And we may in New Jersey have it where we're doing surgery on 14, 15, 16-year-old kids, and that's That might be the way it's going to go. So let's go. Let me grade this last one here. This is pretty interesting. So check this out now. Can you pull this one up for me? So look at this. This is the last one we'll talk about. This is a article. I don't know what article this is out of. And when was it? It was March of. This is an old article. So this has been around, but they're doing it now. So with women with womb transplants a reality, transgender women dare to dream of pregnancies. So I was just reading this here. And I got to do a little bit more research, but believe it or not, a woman who had their uterus removed, right, to man, now they were in this paper here, they were reimplanting the uterus. Now this is somebody else's uterus, and you need to be on a kind of anti rejection drugs. But this is pretty interesting. So it says surgeon at Cleveland Clinic on Monday introduced the recipient of the nation's first uterus transplant performed last month. The 26-year-old patient, identified only as Lindsay, said she had adopted 3 boys through foster care, but has always dreamed of the opportunity to carry a child. The Cleveland Clinic team plans to do at least 9 more transplants of part of the clinical trial. Now, I haven't seen anything lately. I don't know where this is going, if it stopped out. But it's interesting, though. I mean, all of this stuff brings in more and more stuff. So you could do a heart transplant. You could do a kidney transplant. So if you have somebody who, is a male, so now the definition about only women could have babies, right? we could dump a uterus in you. Mm-hmm. And you're right, you had to be C-section. What do you think about that? That gives your definition, a little bit of a
what definition?
Of male. People say definition of man is you can only, a woman, you could have a baby.
Yeah.
But
it messes with it.
Yes, it kind of messes with it. I don't know where this is. I think this is really going to be hard to do. There's a lot of things that, to put a transplant, any tissue, you got to have a lot of medication. But, people have heart transplants. They go for years and years and years, 20, 30 years. Kidney transplants. So I guess, maybe it could happen. Isn't that pretty neat? I don't know where that is right now. That's an article. I'm going to do a little more research on that. But so anyway, you could knock me off.
You got it. Oh, you did it.
Yeah. So what do you think about the whole conversation, Sean? Any comments? I know it's a tough one, and I want to talk.
I really don't have an opinion on this stuff at all. It doesn't affect my life. I don't think about it. It is some people's everything. Some people's complete personality.
Right. They're obsessed by it.
It's not mine.
Yeah. Well, the reason why we've talked about it is because you got battles now in court. You got the federal government getting involved. You get this 14th Amendment being cited. You got doctors fighting back and forth. There's one group of doctors want, another group is saying no. So it's percolating, know.
And honestly, like if you want to pretend that some of those doctors aren't just involved in this situation to make money, you're lying to yourself.
Yeah, but I think that.
No, but seriously, like there are doctors for sure in this field. Not every single one of them, obviously not. But there are doctors that do this surgery because it's very profitable right now.
Mm. Well, all I know is that a couple things I want to finish with. Wait, how long are we at? Can you tell me what time?
I think 1 hour right here.
All right. So here's the deal. First of all, we have to stop. We shouldn't be. Nobody should be nasty to anybody.
Yeah.
No violence. If you know somebody or somebody out there who's, trans. What is it? How do I word it? Transgender or trans. What's the act of being? Trans.
Sexual? Trans?
No, but transing, going
transitioning.
Transitioning, excuse me, I'm getting tired. We should accept these people. I mean, they're human beings. I don't like this stuff on the internet, being nasty. They're all, saying they're screwed up and everything. I don't know what they are, but I tell you right now, in my church, and I talk to people, we should accept anybody, and if they have an issue with their body and what they feel, we should encourage these people. Try to get them health care. I think though on their side, they should understand that a lot of us are concerned about their safety. That if they have this surgery done and they have this irreversible surgery, that if when they turn 18 or 19 or 20, that they're not regrettable because you can't turn it back. So I think on both sides, there's a lot of reasonable people that are really not, nasty or crazy. I think that, these are our children. I mean, it's, there's a lot of parents out there who are dealing with this. And I feel, my heart goes out to them because, do you think about a parent? I was reading one, the guy's in Ohio and they live in a little town and the daughter or son, doesn't feel comfortable, got gender dysphoria. They take him to the clinic. They don't know what to do. And then they put him on his medication. They're depressed. I mean, they're suicidal. I mean, it's really scary time. And then, you try to, some people are saying you don't have to have, don't have the surgery. People are criticizing them. There's states that want to say the parents are, abusing their kids. I mean, it's crazy. I think we have to settle everything down. I think, should it be, I ask you this question, should it be strictly doctor, patient, and that's it? Should it be strictly the parents,
there's
doctor?
There's a quote from Muppets in New York. I think Kermit the Frog says it, and
What
he
does
just
he
says,
say?
"People is people." And that's it.
So
Yes, people is people.
so maybe we should just have the doctor, patient, the child, the doctor, and the parents involved and make the decision.
And Kermit.
And Kermit. Yeah. All right, we'll leave it. But I think let's stop the rhetoric. Let's not be violent. No violence. Everybody, this is an issue here that we're going to get through. We have to look at the science.
Ride the wave.
Ride the wave. Let's calm down. Let's not get violent or nasty. Call each other names. I don't think these bans. I understand. I don't think we should ban this surgery over 18. An adult. That's for sure. Now people may say you're crazy, but that's my opinion. I think like you said, this is the United States. You should be able to do what you want to do. And if the doctors want to perform it, fine. Same thing with abortion. I think after 15 months, 15 weeks, it's a little bit shaky. But again, I'm not about banning anything. But you have states' rights too, and people in the states may not want it. But it goes back and forth. So anyway, I think it's just an interesting issue. We're going to keep talking about it. We've had a couple shows on this, and I
think you've had more than a couple.
Well, because it's a hot tip issue, and I just see the surgery being done, and as a physician, it interests me because I've seen a lot of things come and go. I remember when people were bulimic and people were dying of starvation. Now we got people who are obese and we're doing
rubber bands
and the Ozempic now. Everybody will lose weight, but there's a fraction of people who embrace their weight, and it goes on and on. We go through these trends, and I can tell you in medicine, I've done procedures. We were taught procedures years ago that we don't do anymore because they turned out to be not really effective or good. And this is a tough one. But I think one thing you have to keep out of the mix here is the violence and the nastiness and the name calling. My thing is, I think the parents need to have the right to decide with these kids, and I don't believe that children should be making the sole decision. I think they're too young, So and that's the way that's how I figure. So I know you don't want to comment on that because you don't know. So listen, can you throw up our stuff? So anyway, thank you for watching. This has been Dr. Kachmar, Scrubbing Up with Dr. Michael Kachmar. We're going to put it up here. We have you could give us an email. It's drkachmar@icloud.com, drkachmar@icloud.com. You want to give us an email, we'd love to hear from somebody, anybody who's, going through this. Our hearts are out to you. And like I said, I went on the internet. There's a lot of people, really neat people with web pages. They went through it. They talk about, what they do, how they have sex and everything. It's not nasty. They were very nice.
I bet you were looking that up.
No. Well, I wanted to look because I was looking
sense.
at,
It all checks out now.
Yeah. Hey, listen, my generation, the big thing was, the gay rights, And I wonder what because I know you hear about LGBTQ, I wonder what the gay. I haven't seen really much about the gay.
This is overshadowing it now at this point.
Yeah, but I would like to. I haven't seen too many with the gay community because they used to gay community just be used to gay community. What they feel about all this and what they're
probably loving it. They get to just like live in society underneath the all of this and be like just fine. Yeah. It's not us now. Well, you guys aren't mad at us.
Yeah, but the gay thing was a big civil rights thing. So now this is the next big civil rights.
Civil rights still.
This is that's why the state and the DOJ. You're talking about the 14th Amendment. So that's another whole issue here, which is, going to percolate out. All right. So anyway, listen, if anybody wants to get a hold of us, we have a webpage, JerseyShore-Foot-and-Leg-Center.com. Please give us a shout. We have Sean here. Sean, tell us what other show. We have the lifeguards.
Yeah, we have lifeguards off duty, another show we're doing. Everyone go check it out. We just talk about stuff.
Do we have the, do you have the email, the Instagram for that? Can you throw it up?
So lg.association. I think we got it out of here. lg.association. Everyone go check that out on Instagram.
And that's a show we do once a week too. It's called Lifeguards Off Duty with Dr. Michael Kachmar. And we talk about a lot of fun stuff. We're all lifeguards. We do that in the summertime. So come and watch us on that. We really love to see you. Anyway, Sean, let me get a little music here. I think it was a pretty good show. Mm-hmm. I know it was a little bit, topical, a little bit controversial, but we're not against anybody. Love everybody, peace to everybody. I tell you, I'm a Christian, And anybody's welcome in our church. I don't care what you are. So, Sean, what are we gonna say? Can't say stay out and stay alive.
We got to come up with a slogan to fan you out, Cass.
Yeah. Scrub up and stay sterile. Stay sterile. Anyway, guys, come see us next week.
Bye-bye.
Thank you very much. Bye bye.